Hi, my name is Brittany Deer. I'm a fourth semester nursing student. Today I'll be performing tracheostomy care and tracheostomy suctioning. Today's date is September 14th, 2018, and the time is approximately 11 a.m. So I have already assessed my patient, and my assessment is showing me that my patient needs both tracheostomy suctioning and tracheostomy care. So I have already gathered my supplies. I have already double-checked my physician's orders. Walking into my patient's room, I provided privacy. I have performed hand hygiene, introduced myself to the patient, explain to them what I'm doing, why I'm doing, and what they can do to help me. We have established a form of communication for both the suctioning and the tracheostomy care, and he will tap my arm if he's feeling any distress, and then I'll stop and give him a break. I already have my suction turned up to 80 to 120, and then I'm already hyperoxygenating my patient because I will have to remove the oxygen at some point to suction him. So here I have my supplies, perform hand hygiene. I'm going to go ahead and don on my sterile gloves. A little hard here. So in the clinical setting, I'll make sure my gloves don't roll. So now that I have my sterile gloves on, I'm going to take my non-dominant hand and grab the suctioning catheter. So this is not sterile anymore. I'm going to grab the suctioning tubing, and then I'm going to go ahead and connect, making this my dominant hand. I'm going to go ahead and dip my tubing in some sterile water. I'm going to tell my patient to take 3 to 5 deep breaths, and then I'm going to remove the oxygen. I'm going to go ahead and go in around 5 inches with my thumb over the suctioning. I'm going to draw back for about 10 to 15 seconds because I'm suctioning, twisting my tubing. And then that is my first pass. I'm going to go ahead and look at my vital signs. If the oxygen status is not at a therapeutic level, so I'm going to go ahead and do another pass, explaining that to that patient. I'm going to add on the oxygen, give it about 30 seconds to a minute, tell them to take 3 to 5 deep breaths, remove the oxygen, and then I'm going to go in 5 inches, or until I meet resistance, or until he coughs. And I'm going to go ahead and draw back for about 10 to 15 seconds. And that is my second pass. Add the oxygen back on. I'm looking at my vital signs, and his oxygen is at a good level, so that's telling me that the suctioning is done. So I'm going to go ahead and remove the suctioning catheter, remove my sterile gloves. Since this is done, I'm going to go ahead and move straight into my tracheostomy care. So I'm gathering my supplies. I've still checked my physician's order. I have still assessed my patient, checked my 2 patient identifiers, and so I'm ready to go at this point. So I'm going to perform hand hygiene, and I'm going to don on clean gloves. I'm going to remove the soiled pre-cut gauze. Perform hand hygiene. I'm going to go ahead and put on my sterile gloves. sure in the clinical setting my gloves don't roll. So if I was in the clinical setting, obviously I would have to get new gloves, but for the video's sake, I'm going to go ahead and move on. So I have my tracheostomy kit right here. I'm going to go ahead and set it up. I have my peroxide and my normal saline. I'm going to do half and half in one compartment and then just normal saline in the other compartment. Then I'm going to pitch that. I have my Q-tip in the normal saline, which is what I'm going to use to clean the skin and the secretions. And then I have my brush soaked in the peroxide and normal saline, and I'm going to use that to clean the nasal cannula. I'm going to have it half sticking out so my dirty hand can pick it up and clean it while my clean hand holds the nasal cannula. So I'm going to, with my non-dominant hand, I'm going to go ahead and remove the dirty inner cannula. I'm going to go ahead and drop it in the peroxide and normal saline, let it soak. Then I'm going to pick it up with my clean hand. Then I have my brush, and I'm going to go ahead and clean. Okay, so now that that's clean, I'm going to go ahead and insert it in there with my clean hand. Oh, I guess I would soak it into the normal saline first before I would stick it back in there. I will let it soak, and then I will pick it up with my my sterile hand, and then I would insert it in there, making sure I hear the click. And then at that point, I would take my Q-tip and I would clean the skin area, going in between, making sure it's clean. Okay, and then now I'm going to go ahead and add in my sterile sponge. Okay, so at this point, I'm going to take off my sterile gloves, perform hand hygiene. I'm going to don on clean gloves, and then I'm going to go ahead and change the necktie. Okay, so I'm going to remove the necktie one side at a time. In the clinical setting, I would have extra help doing this, so it'll be a lot easier. Okay. At this point, I'm just adjusting it to make sure it's tight around the patient's neck. Okay. So I am gonna assess my patient, make sure everything's working and he's comfortable, checking my vital signs, and then I will go document. Thank you.